So welcome everybody to today's session. We're going to be talking about social care across the 4 UK countries, which is being held jointly by the Nuffield Trust and the Centre for Care. My name's Natasha Curry. I work at the Nuffield Trust and I lead our social care work. Just before we get into the content, I just wanted to introduce both the organisations involved in this. The Nuffield Trust is an independent health and care think tank that undertakes research, analysis and evaluation with the aim of generating evidence to improve health and care policy and practice. And we do a lot of work understanding international systems to draw together ideas and identify potential solutions for issues in England. And my colleagues Camille and Emma, who you'll be hearing from in a moment, have recently published a set of resources and a series of blogs reflecting on the 4 UK social care systems, how they compare and how the approaches to challenges are diverging. I'm also delighted to be joined by Professor Catherine Needham and Patrick Hall from the Centre for Care, which is funded by the Economic and Social Research Council and the NIHR. And it's a collaboration between the Universities of Sheffield, Birmingham, Kent, Oxford, London School of Hygiene, Tropical Medicine, the Office for National Statistics, Carers UK, National Children's Bureau and Social Care Institute for Excellence. So a big collaboration. And the centre aims to make positive difference in how care is experienced and provided in the UK and internationally by producing new evidence and thinking for policymakers and people using care. Catherine and Patrick recently published a book called Social Care in the UK's 4 Nations Between Two Paradigms, which reflects on the journey of reform in the 4 countries. So today we'll be delving into this very interesting topic and the themes identified in those pieces of work and reflecting on how social care systems in the countries compare, how they've diverged since devolution 20 odd years ago, and what we might be able to learn from each other. So in terms of how we're going to be organising the event, first we're going to hear from 2 presentations. Firstly, from my colleagues Emma and Camille at the Nuffield Trust, who'll be talking about their work, and then we'll move to Catherine and Patrick to talk about the content of their book. We'll then open up to questions and discussion. Hopefully we'll get a very interesting discussion going. Oh, I should have said, so after those presentations, we're going to hear from 4 UK experts who I will introduce when we get to them. So we've invited people from the 4 UK nations to reflect on the situation in their countries and what they think we might be able to learn. Please feel free to use the chat function to introduce yourselves, to make points and ask questions. I'll do my best to monitor that. But then when we open up for questions, I invite you to raise your hand and join the conversation verbally. So I think that's all I have to say on the introduction. I think everybody's keen to get into the interesting content. So I'd like to firstly introduce Camille and Emma Dodsworth from the Nuffield team, who are going to talk about the work that we've been doing on social care reforms across the 4 nations, what it looks like and why it's so difficult. So Camille and Emma, thank you.
Thanks, Natasha. Can everybody see my screen okay?
Yes, it's looking fine.
Excellent. And it's really great to see such a broad and really diverse range of people on the call. So thanks very much for coming. So my name's Camille Ung, and with Emma Dodsworth, we're going to be talking about the work that we've been doing at the Nuffield Trust over the last few years to look at social care across the 4 countries, and in particular some of the reform plans that have been kind of coming down the tracks across all of the UK countries in the last couple of years. So in the interest of time today, we'll kind of focus on 4 key elements, which are funding, choice and voice, the workforce, and local delivery. But of course, recognising that social care systems are much more diverse than that, and there are lots of different types of systems, lots of different services that cater to a really diverse range of people with different needs and aspirations. But I think it's fair to say that the UK systems are both quite similar in their approach, but also different in certain ways. So first of all, the spending across the 4 countries varies quite a bit. So this is looking, the figures that we have here are for per capita for the whole adult population in 2020-21. And as you can see, England spends comparatively less than its immediate neighbours. Another aspect which is quite interesting is the financial access and support. So slight not necessarily representative of all the different elements of choice and access within the system, but I think it does show that the different UK countries have taken slightly different approaches to supporting people to get access to state-funded care. And what you can see, for instance, is that in Wales, the means test is almost twice as high as it is in England and Northern Ireland. There's also a cap on non-residential care costs. There's free personal and nursing care and free domiciliary care in Scotland and Northern Ireland respectively. So different ways to support people to access social care. England is also the only country that doesn't have a arm's length body that kind of has a mandatory role to support the social care workforce, and as such is also one of the only countries that doesn't have a register for its social care workforce, and Emma will talk about this a little bit more in a moment. And then also, it's also worth noting one of the key differences is in Northern Ireland, there is no role for local authorities in the delivery and commissioning of social care. So it's commissioned and delivered by 5 health and social care trusts that are integrated. So some similarities, but also some differences. And I think it's really interesting to have within the UK kind of 4 comparators that we can look to. So I think all of the 4 countries have recognised that there are some shared challenges, and in the last few years there have been some planned reforms, which I'll cover in a moment. Some of the kind of key issues around funding, I think we've all seen that in social care there are budget pressures both at national and local level, and the lack of long-term funding settlement has really limited the opportunity to think more long-term. Lots of competing priorities that have challenged opportunities for reforms, for instance with pressures in the NHS and inflation and cost of living. I think everybody on this call will also recognise that there are challenges around ensuring that people have a breadth of services to draw from that can support them, and so people aren't getting enough care and support that can help them lead independent and fulfilling lives. And often social care access is restricted to those who have the highest needs and the lowest means. Similarly with the workforce, I think we all can recognise across the UK that there are challenges around people working in social care. So with little career progression, traditionally low pay and poor working conditions, I think we've seen lots of challenges with recruitment and retention and lots of exits from the sector. And this has also then created instability. And kind of inequalities across access to protection, for instance, around sick pay, etc. And in terms of local care delivery, I think we also see that providers of care tend to be quite fragmented, and the market for care seems to be quite unstable, and this is a shared challenge again across the UK, with limited incentives for improvement and innovation, and in some cases limited accountability to ensure that local areas are delivering what they should be doing statutorily, so care and support that's reflective of people's needs. So that's the kind of the problem bit, but I think it's been really interesting to see that across the last few years, especially in the last 3 years, all of the UK countries have recognised that the social care system isn't quite delivering as it should. And so there have been levels of reforms planned across the UK in different ways. And to different extents. So in England, there's a number of bills and policy papers, some of which have kind of changed a bit in the last few years, and the cap has been introduced and now delayed. In Wales, some really interesting work on rebalancing care and support, which is currently out for consultation. In Scotland, the National Care Service Bill, which was firstly introduced last year and is currently going through different stages of parliamentary reading. And in Northern Ireland, there's been some consultation as well on the reform of adult social care. So really interesting to see that all of the countries are kind of grasping the nettle of thinking about how to address social care reform. So I'm going to hand over to Emma now, who's going to talk us through some of those reform plans in more detail.
Yeah, thank you very much, Camille. Yeah, so firstly,
every nation does acknowledge the real importance of access to social care services, and particularly the cost of care for individuals, potentially third parties such as friends and relatives, and also the local authority as well. So as such, each nation has proposed reforms to improve the offer, but naturally they vary a little bit. So England, for example, is focused very much on protecting individual assets. So they are proposing the introduction of a lifetime cap on personal care costs at £86,000 and extending the means test to £100,000, although that's been delayed to 2025. Now, Scotland and Wales are being a little bit more ambitious with their reforms. So Scotland are proposing to remove the charging for non-residential care and bringing personal nursing care rates for self-funding funders in line with the National Care Home Contract to address some of the issues in the cross-subsidy that self-funders are paying for their care. But it's important to note that this is in consultation, so not currently in the National Care Service Bill. In Wales, they're probably the most ambitious, I guess, and they are committed to producing an implementation plan by the end of this year for the National Care Service, which is designed to be free at the point of use. Although this is only a kind of implementation plan, and what it will look like sort of in the near or long-term future is really somewhat unknown and still in discussion. Then finally, Northern Ireland is a bit of an outlier in terms of reforming funding here, because they already provide state-funded home care, but they are reviewing third-party top-ups in care homes to reduce the inequity and the burden on families and relatives. So I think it's important to note that across all four nations, these reforms do require the nations to think a little bit about whether they're able to potentially reprioritise investment for social care, potentially over other services, and whether they wish and desire to kind of explore different ways of funding social care reform. So yeah, next slide please, Camille, if that's okay. Yeah, so plans to improve workforce sustainability. Again, all four nations recognise that it's a real top priority in reforming the social care sector. The existence of sector-specific bodies for Wales, Scotland and Northern Ireland arguably have enabled them to address address the problems in the workforce, come up with some potential solutions and really put workforce on the top of the agenda. However, all four nations are united in trying to improve working conditions for staff in the sector and have drawn up many different policies around career progression, additional training for skills and development, etc. So yeah, but all nations are really, they do recognise the importance or the fact that low pay is like a chronic issue within the workforce. So Camille, yeah, thank you. But only Wales and Scotland have actually committed to paying the fair wage, which is an hourly payment above the national living wage. But it's important to note, however, that this does come with some challenges. So for example, the packages that are given in giving this uplift to the fair wage are often short and non-recurring, which creates a certain level of uncertainty for providers on how they're going to pay their staff this new wage and where that financial responsibility lies. It's also worth noting that that with the more recent and obviously general increases in national living wage, that this uplift is not quite as significant as it once was when it was first implemented, and really raises questions over kind of competitive pay within the sector. Now, Northern Ireland has expressed interest in implementing the fair wage in accordance with the Fair Wage Convention, but that's somewhat sort of fallen away more recently, but there's hopes to bring it back onto the agenda. But in the current state as it is, both in Northern Ireland and England, it remains at the discretion of providers to pay their staff at what they want. Yeah, then you pass it on. Thank you. So finally, throughout all of the nation's reform plans, it's definitely called into question the role of local delivery of care and the fact that it's sometimes not quite working in the way that we would hope and like to do. So naturally, all nations have explored the
potential possibility of increasing the role of national government, but again, to varying degrees. So in England, perhaps unsurprisingly, the local government is still held accountable, but they are increasing oversight powers for the CQC to maintain a level of quality of care across England and also financial stability within the sector. We then have Wales, where again, the local government are accountable, but they have established a national framework for commissioning, which is essentially standard principles across Wales that will hopefully improve commissioning across and sort of decrease the variability of care that's happening within the country. We then have Northern Ireland, which, as Camille has kind of mentioned, is that because they've integrated health and social care trust, they naturally have a little more national oversight than England and Wales, but their focus remains very regional. And so they've set up a regional population health and wellbeing plan to address some of those challenges. And then finally, we have Scotland, that under the National Care Service Bill, they will be replacing local authority with a complete national oversight in the hopes of strengthening local delivery of care. Thank you very much.
Thanks, Emma. So in the last kind of few moments of our presentation before we hand over to colleagues at the Centre for Care, we just thought it might be nice to reflect on why it's been so hard traditionally to reform social care. So at the beginning of the presentation, we showed you a slide with some of the plans for reform and the ways that the different countries have thought about reforming social care in the last kind of 3 years or so. But it's worth reflecting that in England, Scotland and Northern Ireland in particular, there's been some level of delay or challenges with progressing with the reform plans as intended. So as Emma's already mentioned, the charter reforms in England have been delayed until 2025, with the savings retained to help with current pressures. The next steps of the readings of the National Care Service Bill have been delayed in Scotland, and I think again there's been some questions around the funding and the planning and what it actually is going to mean in practice. And in Northern Ireland, the current executive deadlock has also limited the opportunities with which reform can be progressed with, as there is kind of that need to have some ministerial backing to get some of these reform proposals ongoing. So we published a blog a couple of weeks or months ago, which discovered or goes into some of these reasons in a bit more detail. So yeah, in terms of why we think this is hypothesis, will be interesting to hear in the discussion whether people agree or not. But firstly, with the financial uncertainty, so I think long-standing pressures on budgets and the limited ability to raise funds in the long term have really limited the opportunities to think more creatively or about social care reform. And again, these competing priorities have sometimes derailed plans that were a bit more ambitious to reform social care. As we've seen in Northern Ireland, the challenges around political leadership and stability have also hampered sometimes how we've been able to engage with reform. And there's also, it's tended to be quite a political hot potato, so to speak, with different political parties disagreeing over what social care reform should focus on. And recent changes in leadership have again kind of derailed or changed the direction of travel slightly. And then finally, reflecting on kind of some of the work that we've done on other countries such as Japan or Germany, I think it's been interesting that other places have really considered reform in quite a comprehensive way and addressed all of the different parts of the system in a way that can really address system reform holistically. And it's possibly fair to say that in the UK, we've tended to focus potentially on one or two issues, and funding has consistently been one of the questions of debate, and it's often been framed as a cost rather than investment, and so there's a need to kind of move away from that dialogue and that framing to see it more as an investment, as an opportunity to build a system that can really deliver for people who draw on social care. So I think I'm going to hand over now back to Natasha, and we'll have our second presentation.
Thanks, Camille and Emma, for setting out the context there. It's really helpful background to demonstrating that the four countries share many of the same challenges, but have diverged in terms of their approaches and structures of their systems. I'm now very pleased to introduce Professor Catherine Needham and Patrick Hall, both from the Centre for Care, are going to pick up this the presentation and reflect on why reform in social care is so sticky. Thanks, Catherine and Patrick.
Thank you, Natasha. It's great to be here, and thanks to you and colleagues at the Nuffield Trust and our colleagues at the Centre of Care for organising today's event. So Catherine and I have been working on our study of social care in the UK's 4 nations over the last kind of 4 years, and we interviewed policymakers and social care stakeholders all across the constituent systems, and I'd imagine quite a few of you here that are present today. So a big thank you to you for being here as well. And we also looked at policy documents from across almost 25 years. So that's just a bit of background. Can I have my first slide, please? Great. So we found that although there are similarities, kind of given the common origin of the systems, there are clear areas of divergence, and we can categorize the 4 in the following ways. I mean, Scotland has differentiated itself through a kind of ongoing and iterative reforms in different parts of the system: free personal care, registration, pay guarantees for care workers, more generous benefits for carers, so on. Action on self-directed support, but that action in self-directed support has been slow. The proportion of people with direct payments is lower than in the other nations. This and the ways in which free personal care may exacerbate rationing and encourage a kind of functional based approach to care commissioning means that on average the experiences of people in Scotland may be no better than other parts of the UK. Wales has emerged as a kind of distinct system, having been kind of hampered by a lack of governing capacity and capability, as well as kind of deep spending cuts that have affected England. Wales has a maximum charge for home care, more generous means test, registered care workforce, but as with all of the nations, doesn't development of carers' rights, development of self-directed supports are no more advanced in Wales than anywhere else. England's reforms, while symbolically and rhetorically significant, and the Care Act had this kind of huge momentum behind it in terms of trying to change the system, we feel that it's failed to significantly improve the system for most people. But then, that again takes place across the backdrop of huge, unevenly distributed cuts over the last couple of decades, and indeed, huge variability between England's 152 local authorities means that kind of this sort of generalisation about England is particularly difficult. Northern Ireland's policy response has been limited by its political and institutional characteristics. It has a registered workforce, has de facto free domiciliary care, but continues to have deep-seated problems around care workforce supply, delays in discharge, and of course a kind of hugely challenging political environment. Next slide, please. So Catherine and I published an article on the concept. We applied the concept of policy drift to this policy area, and we identify some of the key institutional factors which may help or hinder social care reform. So you can see those factors are spending cuts, the lack of automatic uplift and automatic change mechanisms within existing policy, the existence of key veto players, partisan political divisions, uncertain outcomes, and a kind of agenda overload as being the key institutional factors. We suggest that kind of the key part of unsticking reform is to pay political attention to understanding how these factors might be mitigated, and if that doesn't happen, then all of these kind of stalled reforms may find it really hard to be implemented. Next slide, please. So developing this in the book, we looked at scale, style and scope of policy in the four nations. We think this makes it easier for Scotland to go further on care policy reform, being, you know, a more kind of a relatively consensual policy environment with relatively few veto players, although of course these are now emerging in interesting ways in opposition to the National Care Service plans. England's been hampered by its larger, more siloed institutions, influential veto players and overloaded agenda. Wales and Northern Ireland have had constitution building factors to deal with throughout the period, which have delayed or inhibited, in the case of Northern Ireland, their capacity to be active policymakers in social care. I'm going to hand over to Catherine. She's going to talk about policy mix.
Thanks, Patrick. And yeah, very mindful of the point that Rachel made in the chat about kind of recognising the difference between the kind of some of the rhetoric and the reality here. I guess the sort of the difficulty of analysing such a moving picture as well. So I think when we kind of put the final full stop in the book, there was a sense that Scotland had this momentum towards the National Care Service. Now, a year on, that doesn't feel to be quite the same position. So I think that's why we're really keen for the kind of discussion to bring this bang up to date. But just to finish in terms of the presentation part of today, I just wanted to bring us to this notion of the kind of the policy mix within social care and the need to pay attention to the interdependencies between the different aspects of the mix. So next slide, please. So in looking at the four nations, we found that what they were trying to do in social care was really very similar, and many of these are things that Camille and Emma covered in their presentation. So it's something about making care fairer in terms of costing, more personalised, doing more for unpaid carers, whilst also investing in prevention, integrating with health and professionalising the workforce. And what we found, I think, Camille, you also touched on this, is that when all of these things are attempted at once without sufficient attention to the interdependencies between them, then we start to see the kind of the inability to deliver on the rhetoric around some of these things. So we would argue, for example, that we need to pay much more attention to some of the kind of interdependencies in this space. So next slide, please. So I think in particular, we could say in Scotland, which we characterise as having a much more active legislative agenda around all of this, we find that some of the momentum around self-directed support from the kind of the 2012 period starts to ebb away because attention in the system starts to move towards the new integration arrangements and putting energy into that and getting those kind of structural changes made. You know, we start to see the kind of this sense of kind of that people are still talking about self-directed support. We're not seeing the kind of momentum around, say, direct payment take up that we might have expected. So it's thinking about the ways in which the policy agenda moves on, and there isn't sufficient attention given to the mix between all of these. And in particular in the book, we sort of separate out, if we think about those kind of 6 reform areas, we say some of them are about a vision of social care or a paradigm which is about, let's make it more local, more fluid, more differentiated, let's emphasize informality, let's take risks, let's emphasize co-production, let's make sure it's kind of as local as possible and as different as possible. And then there's a kind of vision of social care or paradigm which is about, let's make it as safe, as standardized, as regulated, as professionalized as possible. And trying to do all of those things at the same time without acknowledging the differences between them means that you've got these kind of constant tensions, which we think is part of the reason why policy reform has got stuck. So next slide, please. So we've kind of just characterised those there then as this sort of scale, sort of tipping of the scales that many of the things that we think we've seen most recently, particularly around integration with health, the increased role for the CQC around local authority assurance, are around saying, let's have a system which is the same for everybody. I think we see the same kind of rhetoric in the National Care Service in Scotland. Let's make it, you know, get rid of the postcode lottery, make it as consistent and safe as possible. Let's make it a highly professionalised workforce. And then that pulls against some of the other things which have been going on perhaps earlier in the last decade around, let's make it person-centred, you know, as much direct payments, micro-commissioning, diversity. Let's recognise that social care is not a destination, it's a route to do other things and to have a meaningful life, and let's make it more like that. And that we feel kind of a lot of the energy around that has been lost. So just in conclusion then, in terms of kind of the topic of today, which is really how we unstick care reform, and we're really keen to hear from all of you about ideas around that. I guess some of our work around picking out the drift factors maybe draws attention to how we think about minimising the drift factors. So there was some interesting work done around the Affordable Care Act in the US under Obama about the way in which future-proofing of that bill, for example, introducing kind of automaticity into it, was an important part of thinking, how do we make sure this is not just going to be subject to constant delays or kind of rewriting by states? And that's only been partially successful, but I think it's about thinking about that at the point of introducing new policy. It's about recognising that there's a certain kind of scale, style and scope which make it easier to make policy, and maybe doing that at the Westminster England level is too big, so thinking more, we haven't talked about city regions today, but that may be thinking about where should decisions be made, and kind of keeping that as small and local as possible. Think more about the policy mix. Don't assume that we can just do everything at once and then get kind of fatalistic when it fails. And then I guess finally, and I feel this is maybe contradicts what Camille said, which is great, because that's what our discussion is all about, is that we don't necessarily need a once and for all, let's try and do everything at once approach, because I think that is potentially risky. And maybe the learning from some of the places that have really done this, so places like Germany and Japan, is the idea of sort of staging it, doing some of it in a kind of sequenced way, because I think there is a danger if you're kind of Boris Johnson, you stand on the steps of Downing Street and you say you're going to fix social care once and for all, then actually that falls apart very quickly. So just the final slide. It's just say, if you want more about our methods and the references that we mentioned, then you can get those from us directly or in the book. Thanks.
Thanks very much, Catherine and Patrick and Camille and Emma, for setting out the context there. And I think, as you've touched on, this is hugely complex with so many sort of tensions and different sort of priorities coming through. And I think, just picking up a comment you made there, Catherine, I mean, the ultimate purpose of the care service is to enable people to have meaningful lives. And so keeping in mind that eventual outcome of all this, of policy change, and how to ensure that the structural changes actually deliver a tangible change on the ground for people in need of care. So I'm really delighted that we are joined by a panel of experts from each of the UK countries who've kindly agreed to say a few words from their perspective in terms of what they've heard today, where things have moved on, perhaps, because, as Catherine said, this is a moving picture and it's been very difficult to capture such a changing environment. So I'm going to introduce our panel of experts who are going to say a few words about their perspectives on social care reform in their country, and maybe perhaps what they think we could learn from the other UK nations, and then we'll open up to a wider debate. So do get your thinking caps on with questions and comments. So in terms of our panel, I'm delighted to welcome Stuart Hoddenott, who's a senior researcher from the Institute for Government, who's going to respond from an English perspective. We'll then hear from Patricia Higgins, who's Chief Executive of the Northern Ireland Social Care Council. Then I'm going to come to Donald McCaskill, who's Chief Executive of Scottish Care, and then we'll hear from Jonathan Griffith, the Transformation Director for Children and Adult Social Care at the Social Services and Integration Department in the Welsh Government. And we've set each of our respondents the difficult challenge of speaking for around 4 minutes, which I know is going to be very difficult, but I'm sure they're up to the challenge. So if I could welcome Stuart first to give his thoughts, and then we'll move through the countries. Thanks, Stuart.
Thanks much, Natasha, and thanks everyone for those presentations. They were really, really interesting, some great insights. I'll try and stick to 4 minutes, but I can't make any promises. So I think to jump in first of all to the question of why has adult social care reform proved to be so difficult in England, I think I'd like to split that question into 2 parts. First, why reform has failed for more than a quarter of a century, And second, why this particular round of reform has failed. And by this particular round, I mean the charging reform that was mentioned before, and also the people at the heart of care reform. And I'll start with that second bit first. Why has it proved so difficult to get this round of reform actually implemented? I think for this, I'd like to start with the difficult place that most local authorities and the entire adult social care sector find themselves in coming out of the pandemic. The immediate cause of that is obviously the pressure of COVID on both local authorities' finances and also providers. But it's also worth mentioning that local authorities entered the pandemic following a decade in which they bore disproportionate funding cuts as part of central government's programme of austerity. The result from that was they had to make substantial cuts across a range of services, including adult social care, meaning that they entered the pandemic very poorly resourced, a situation which is still the case now. On the social care market side of things, there's that providers are also in a parlous state coming out of the pandemic. Their staff suffered immense pressure during the pandemic with high levels of stress and burnout. And when the pandemic abated and the labour market tightened, many workers left for better conditions and pay in other sectors. The result is record vacancies, which has massively constrained supply. And on top of that, providers then struggle to deal with the pressures of inflation, which has caused their cost base to increase more quickly than the fees they receive. The result is a lot of instability in the market, with many providers leaving or handing back contracts. And that brings us to this, in a roundabout way, to the charging reforms. That post-pandemic fragility means that local authorities do not have sufficient resources to implement charging reform at the same time as stabilising the market. This is both in terms of money, but also in terms of staff. The money that was put aside for charging reform has been directed towards better funding the service, as we've seen earlier on, but that will only really help the service tread water and bring it back in line with demographic and inflationary pressures without actually really implementing any improvements or reform. On staff in local authorities, there's only one DAS in each local authority with a limited team, and the work required to both stabilise the market and also to try and implement charging reforms was enormous. Just as an example, it was expected that charging reforms would have required a large increase in assessments, far beyond the amount that the limited number of social workers could actually carry out. This is why there was actually a lot of pushback from local authorities and providers about implementing charging reforms in 2023, and why, without a large injection of further resources from central government to stabilise the service before implementing charging reforms, that implementation would likely have been very difficult in October this year. So that then brings me back to sort of the longer term issues. And I think these also are at play in this most recent round of reforms. I think there are a number of reasons for the lack of reform over the last quarter of a century or so. First, I think the politics are really very difficult. For a start, there's bad understanding or poor understanding in the wider public of what social care is or how it's delivered, with many respondents to surveys repeatedly thinking that it's either free at the point of use or delivered by the NHS. And it's sadly much less well covered than other services such as the NHS, policing, education, or really any other service that the government provides. And that really distorts political incentives. There's always a greater political win available for the government from putting funding into, for example, the NHS rather than social care. And we saw this in the last winter when there were ambulances queuing outside hospitals. That directed all political attention towards easing the urgent emergency care crisis in hospitals and led to adult social care being referred to mostly in terms of how it could support relieving those pressures. And politicians prefer saying, overall, we've met our target to hire 50,000 more nurses than we've raised the lower capital limit of the means test for social care. The former is much more easily understood by the public and gets much better headlines than the latter. I think secondly, comprehensive reforms will cost a lot of money. And that means either more taxation, more borrowing, or cuts elsewhere. I think this is where Catherine and Patrick's point about veto players comes into play quite a lot. The Treasury are incredibly powerful in government, and they will likely resist either more taxation or more borrowing unless they can find a specific way to fund these reforms. And so that makes a particularly difficult task for people who are interested in implementing reforms. And I think for all its faults, at least the most recent round of reforms actually had a funding stream attached to it in the form of the health and social care levy. But as we saw in autumn last year, that was a very easy win again for Liz Truss to decide to scrap that. So again, we end up back in the same place of trying to implement massive and expensive reforms without the funding stream available for it. I think third, it's also a very complex policy area with 17,000 providers in England, employing over 1.5 million people, interacting with 153 local authorities, and providing publicly funded care to over 1 million people. Finding a solution that is amenable to all those stakeholders while also being politically and budgetarily feasible is extremely difficult. So I think all those things, we've seen them play out time and time again throughout the last 25 years, where there's been a push for reform before it meets the realities of politics, of finances, of on-the-ground implementation.
Thanks, Stuart.
Thank you very much.
Thank you. That's a really nice roundup. Politics, money, complexity, really nice summary of some of those factors. Patricia, it would be great to hear from you on Northern Ireland and where things are there.
Okay, thanks, Natasha, and thank you for introducing me as an expert. I'm not sure that I would claim to be an expert in this field, but I'm working a bit in it. And you've just said politics, funding and complexity, and I think that sums up where we are as well. And I think both sets of presentations have sort of very ably outlined the context of Northern Ireland where we are today in terms of a political impasse in relation to government, and also really quite stringent financial pressures in terms of our funding situation, and in particular in health and social care. I would also agree in terms of just, why is social care difficult to move on? So today, that's why it's difficult to move on. But I think also Stuart talked about people understanding social care and the value of social care. And I think I would argue that over the last number of years, really social care hasn't been seen in terms of its value within our broader health and social care system. And I suppose it came to the fore for everybody through COVID, but it came to the fore in the context of a particular focus and over last winter, for example, it came to the fore in relation to winter pressures and delayed discharges, which Stuart talked about as well. So for us in Northern Ireland, trying to keep the focus on the diversity of social care and the importance of social care in the context of the broader health and social care system is really important. The winter pressures and delayed discharge, I suppose, were an impetus for, I'm going to talk about a new initiative that's happening. So despite all of the doom and gloom and despite all of the issues that we have in terms of having government and ministers to be able to move a lot of this forward, and somebody mentioned, I think Camille mentioned that we had, government had undertaken a large consultation on the reform of adult social care, and the outcomes of that have just recently been published at the end of last week or the beginning of this week, with huge support for it, but obviously real concern about how it will be funded going forward. But nonetheless, as a consequence of the winter pressures and delayed discharge, the NHS Confed branch in Northern Ireland, NICON, and ourselves ran a rapid action workshop at the start of the year with providers around what could we do to begin to look at potential solutions. And out of that has grown the Department of Health have led a development and have established a social care collaborative forum. Now, this is the first of its kind. It's in Northern Ireland. It's sitting within the Permanent Secretary's transformation programme. He has a transformation programme in relation to health and social care, and we've positioned social care right within that transformation programme at a programme board level. But uniquely what we're doing is taking it forward on a collaborative and co-produced basis. So I co-chair this forum with the Deputy Permanent Secretary, and around the table are representatives from providers from all sectors, whether it's trusts, whether it's private sector or voluntary sector. Also, we have service user and care representation. We have the service regulator there. We have ourselves at the table and Department of Health officials at the table. And our aim is to begin to find solutions to the issues that we're facing in relation to social care, and to co-produce those together, recognising that the people who are receiving services, people who are delivering services have the knowledge, the collective knowledge and wisdom to know what might make a difference in terms of arriving at solutions. So this is very much solution focused. It's not, I think the point about trying not to do everything all at the one time is really important. So we started where people have identified the immediate priorities to be, and And actually, one of the immediate priorities is looking into next winter and how can we maximise capacity and try to ensure that we don't end up in the same position as last winter in relation to delayed discharges. So we're looking at maximising capacity across care home and home care provision. And we set up a series of work streams that are being co-led as well. And again, the solutions will be co-produced. So we're looking at that. We're looking at workforce. And obviously, as the workforce regulator, we've been doing a lot of work in the workforce space around developing career pathways and trying to support the building, the sustainability of the workforce. But there are other challenges in there as well, not least terms and conditions. And also looking at data and intelligence and trying to build, there's a lot of data and intelligence around social care, but it's not joined up. So how do we start to join that up and begin to help then to inform what the picture is and therefore what some of the solutions might be? So that's an example of some of the work streams. There are others. It's early days for this. And we are doing it in the absence of a government. So clearly some of the solutions will require more funding. I've no doubt about that, and there will be debates about that, but some of it won't. Some of it will be about how do we do things differently within the existing resources that we've got. And I think trying to open those conversations and discussions up and thinking about how we do things differently will be really, really important, and as important as looking for additional resource. So I suppose, Natasha, that's enough maybe just to give a flavour of Northern Ireland, and I'm certainly happy to answer questions.
Yeah, no, that's perfect. That's hugely interesting. I'm sure there will be a lot of questions on the back of that, which we'll come to in a moment. Donald McCaskill, can I invite you to give a perspective from Scotland, please?
Thank you. Thanks, Natasha. Now, I'm in the unusual position of being a Scotsman, having my nation described as somehow or other being top of a league, imaginary or otherwise. So it's interesting. Some of the chat comments probably concur with my own perspective, which is maybe a little less glass full and a little bit more glass empty. So I do completely agree with what Stuart and Patricia have said. And I suppose the first thing I would say is that one of the reasons that we're struggling around reform in Scotland is that we don't have a shared vision or a shared collective communitarian or indeed political understanding of what social care is. We still live, not least in the winter period, in a reactive understanding of social care as somehow or other the bed child of the NHS, there to help good old mother NHS when a crisis arrives. We fail to understand social care in a preventative, holistic manner where we see from early years to later life, social care as enabling independence, as fostering citizenship and bestowing rights upon individuals. So until we get to that situation, we will continue to have a reactive response. I think the second thing is that one of the reasons we failed in Scotland is ironically and maybe paradoxically, because we have not been sufficiently systematic and comprehensive and holistic in our attempt to reform. So Patrick mentioned what has been happening in Germany and indeed what has been happening in Japan, and I would add to that Sweden. I think one of the reasons that we are failing in Scotland is that we have not been sufficiently holistic. And whilst there is an understandable desire not to take on too much and to do bits, the failure to do a whole system reform of social care is, I think, intrinsic to some of our problems. We can probably manage that better given the geography and the demography of Scotland than it might be in England, but it's a missed opportunity. I think thirdly, as a result, a lot of our reforms have been reactive and spasmodic, with a failure to appreciate the unintended but very much foreseen consequences of individual action. So take free personal care, which is much lauded elsewhere in the United Kingdom and indeed amongst politicians in Scotland, because nobody will ever vote against it. But actually, if you do an independent analysis, has been hugely damaging in the sense that it has driven out a preventative approach. It has introduced a much more functional time and task approach to not least home care and care at home. And it has diminished a relational approach to social care, which ties an individual to a set of functions and time slots rather than enabling independence, choice, and individuality. Now, we have, fourthly, a tremendous legislative programme, but legislation, however good quality it is, which isn't able to be implemented, is absolutely wasteful and actually just increases frustration. And the Self-Directed Support Act is a glorious example of that. SDS's success is not about how many more people are using direct payments. It was never intended to be a direct payment piece of legislation. The failure of SDS is the failure for people to exercise the broadened degree of choice that they could have. I think the fourth comment I would make is that we are still somewhat failing to understand the integrated nature of our health and social care systems. Rachel from CCPS has put in the chat the obscene reality today, whereby an individual working in frontline social care as a care worker is now, following a recent pay settlement with the NHS, being paid 19% less than somebody doing the same or equivalent job. So ironically, the failure to understand social care as distinctive, and at the same time, the failure to understand its interrelationships with the NHS are two of the reasons where we are facing difficulties. And just to conclude, I think the last thing to mention about Scotland is the veto players. The reason the National Care Service has been so criticised is because of the dominant veto player, which is local government in Scotland. The reason that SDS has failed is because of the dominant veto player, because of local government and the resistance, albeit during a period of austerity. So the glass is a lot less full in Scotland, and a lot of that has to do with our failure to see a whole system and a vision of the future, which is not the piecemeal offer that we're currently being given. Thank you, Natasha.
Thank you very much, Donald. That's a really, really thoughtful and insightful summary of where things are in Scotland. And yeah, I think it's all relative, isn't it, in terms of progress? I think the other UK nations might look to you and see progress, but as you say, it's not. You know, there are certain downsides to some of those approaches as well. So let's hear from Wales before we get into a broader discussion. Jonathan, welcome.
Thank you, and thanks for the opportunity to speak today. I'm going to stay on the positive bus, so to speak, or glass half full, as opposed to the previous presentation. And I say that from a perspective of working with the Welsh Government at this moment in time. So I think I'm pretty welcoming in Wales from what you've outlined in the presentation thus far to the advent of the National Care Office in Wales. I think that's a way forward for us to promote social care in Wales, to develop that national commissioning framework that we seek to put across the country, and to enhance our actual role with other policymakers across the health sphere in Wales. I think there's an imbalance there, I think it's been mentioned through the presentations today from other parties. But just sticking to the factors that were outlined in the presentations earlier, the kind of things that we obviously need to keep account of are around that. Changes at scale was mentioned, I think, as one of the factors in there. And I think Wales has a fantastic opportunity in terms of our size, our dynamic, our closeness to political and local government arrangements to actually make changes at scale. And the ambition around a national care service is clearly an advent of that, or the role of regional partnership boards in Wales, and trying to develop that in the future as a real partnership space to deliver change. I think within that change at scale, there has to be an equality of relationship between the NHS and social care. And we are far too often the poor relation to one side. And that therefore is why we get to a position where we feel we're not valued and there's not parity of esteem. I guess the ignoring independencies and tensions, that was an interesting point raised, wasn't it? I think prioritization is extremely challenging when you've got really ambitious political programs, and how you actually slow down those ambitions to some degree based on what is the required priority. He says receiving a doorbell knock in the sidebar here, so I'll put that to one side. And you know, we are in a session today talking about the outcome of the report that you've brought to us, and that is an extremely important point for me as well. How do we actually apply the research? That there's a plethora of research across the UK, internationally, etc. And actually, how do we navigate that landscape and actually apply that research to practice? And how do we change, therefore, the landscape of social care? There are many examples and suggestions of a way forward for social care as outlined today. But ultimately, we've got to apply that in Wales terms 22 times into local government. And how do we do that consistently? Potentially, the National Care Service is one such option, and national commissioning frameworks, etc., are ways and methods of applying things nationally. So I think we've got real opportunity in Wales. I can see colleagues on the call from Social Care Wales, and that role was outlined earlier, and I'm really positive about that relationship and how we develop the workforce in Wales, professionalise the workforce, and face the key challenges of the workforce together. You know, and if we can learn from each other in that space, then that is essential as far as I'm concerned. As I said when I started this presentation, the National Care Office for me is a positive place for us to be. It's cross-political support as well. So I think that programme over the next 3 years is imperative to Wales and its success moving forward. It was positive actually to listen to the earlier presentations about some of the activity in Wales, but I think it now comes down potentially to me to how we actually deliver this on the ground, how we structure this change on a national basis and get cohesive agreement across 22 local authorities, which is a challenge in itself.
Thank you very much, Jonathan, for another very helpful, insightful overview from Wales. Those 4 respondents, you've covered so much in there, and there's picking up so many issues. And I think, as you say, there's an incredible amount to learn and unpick here. And I'm going to open the floor to questions and comments if people want to start putting up their hands. But I think one thing on my mind, picking up some of the points about solutions and learning, is in the absence of the national political leadership, which has been pointed to by several speakers as one of the fundamental barriers, is there potential for change anyway? And if so, where is the impetus? Who can drive that change? And do any of the countries, I think maybe one of the examples that we might want to hear a bit more about is in Northern Ireland, and that's role of co-production in coming up with solutions. But I was just wanting to invite our speakers maybe to reflect on that. I see we have a hand up from Rachel Cackett. Did you want to come in on that point?
Yeah, and thanks, Natasha, and thanks to all the speakers so far. It's been really interesting to hear across the nations how reform's going, and I think we're all in a very stuck place at the moment. And I think the tick box slide that was up earlier, which I appreciate was done perhaps a while ago, I would say needs a few more ticks in Scotland in terms of some of the barriers to getting work done. I guess I want to come back to the point about reform needs a sector to reform, and I think that's where we are, certainly in Scotland, on a very sugary hook, as you'd say up here. Things do feel incredibly unstable, largely because of the lack of investment. At CCPS, we represent just over 90 not-for-profit providers from right across age ranges in Scotland, and our members are very clear that recruitment and retention, which was brought up early by your speakers, is an absolutely key issue here, because the differentials that we're now facing, despite the government's commitment to the Fair Work and Social Care recommendations some years ago, is, as Donald noted in the chat function I put in a slide we put together in February, widening dramatically, and it's creating all sorts of internal issues, as are the direct pay policy decisions that the government is making around the commitment it has made to 1090, which is only for registered adult social care services on a percentage of contract. That gives us all sorts of perverse implications for providers, and it also transfers all sorts of risk, like the risk of equal pay claims, to individual providers who are trying to make this work. I think when we have gone to the Scottish Government to say we need to see recruitment and retention addressed in a really comprehensive way, and you need to start with pay terms and conditions, we're also always told there is no more money. And it always comes at a time when somehow in the same week they seem to have managed to uplift nurses' salaries, local government salaries, junior doctor salaries, and all sorts of others. And I think there's a really important point here. We say the government has no money. It's a sort of mantra that we're all saying. The government, of course, each government has money. It's making choices about where to put that money. And the fact is, certainly in Scotland, the choice is not to put that money in anything like an equitable fashion into social care, despite how it may look from the outside looking in. And I think there is something about the lived reality of being in the sector in Scotland at the moment that feels sort of jarring with what's being presented. That is certainly not the experience of our members at the moment. And the baseline may be low for comparison, but that doesn't mean we're in a good place. And the fact is, the government will say there's been a 14% pay uplift to the sector, which completely ignores the fact that we started from a benchmark that's so low that Scotland has a commitment to be a fair work nation by 2025. So not paying the real living wage really isn't an option. And that's all we're at, and only for part of the sector. So the National Care Service is very delayed. It's very structural. I'm going to post in the chat something that we did at CCPS around vision. But I would agree with Donald. I feel like the vision is quite fragmented. And until we can get to a point where a vision is genuinely about choice and control, not command and control, where we're not trying to emulate the NHS, and where we stop talking about social care like it's the savior of the acute sector, we really aren't going to get very far. We have to unstick that dialogue to actually unstick reform.
Yeah, thank you. Yeah, and as Donald has added in the chat, the failure to disinvest in the sector in acute and actually move that resource along with the narrative around investing in out of hospital services is at the heart of this. Patricia, did you want to come in here?
Yeah, yes, I did. I just wanted to come in on a few of the points that were made, and I'll just come in on the last one about unsticking social care from the connection to acute. And I mean, I think we feel some of that frustration, and I certainly felt a lot of that frustration last winter when the winter pressures were here, and it almost felt like social care was the cause of all of the issues to do with hospital discharge, and we all know that that's not wholly the case, although we do need social care. So I think you're right, and in terms of the work that we're doing, we're holding firm and fast to the fact that social care is very diverse. We're reflecting the diversity of that. We might be starting with a priority that we know we need to address, but it isn't the only thing that we will be looking at. And we have the range of providers around the table representing the range of people who would be receiving social care. So I think that piece about the diversity of social care and the importance and value of social care is fundamental to the work that we want to do. I also think the piece about having a vision, a very clear vision about what social care is, how it contributes to the health and social care system, but also how it contributes to people's own well-being. It's not just about contributing to the healthcare system, I think is really important. And I've said that we've just had the outcomes of the consultation published. We now need a strategy as well, and the Social Care Collaborative Forum, while it's starting where it's starting, ultimately my hope would be that it will then take on part of that strategy in relation to what's coming out of the reform of adult social care proposals. So, but we clearly do need that. But your question, Natasha, about, in the absence of political leadership or willingness or whatever, can things be done? I think my answer is yes, which is why we have this Social Care Collaborative Forum. And I think that's because there is a willingness across government, but also in relation to those who are within the social care sector to actually seek change and to find solutions, because no one wants to be in a position of delivering poor social care or not sufficient social care. And we need to find a way to get our way through this. Where the politics will come in is when we need resource. If we need resource, and undoubtedly there will be resource required, and that's but it doesn't stop the work happening in our view, and we need to get on the front foot a bit with this. So I think that's why the department have taken the decision to actually take this initiative forward. I think it's quite a brave decision on behalf of the department to do that in the current climate, to say let's get on and see what we can do, let's get on and see what the solutions are. And there is as I said, a lot of willingness within the sector to get around the table and to begin to do that. So I think, yes, you can. We will hit difficulties, I have no doubt about that. But yes, you can get on and start.
Thank you. That's very interesting. I think you touched on something that's come up in the chat a few times around this sort of public understanding of social care and that kind of value in society, and where social care sits. I mean, can I come back to some of our panel members and your thoughts on how fundamental it is that we rewrite that narrative on social care and set it in a different framing?
Yeah, I mean, I have to come in on that. I mean, I think the chat and the comments have been really useful in just highlighting that this ultimately will have to be a political solution, and it will have to be about public support and public investment. And there is no really way to get around that in any of the 4 nations, and that the countries that have done that have recognised that and have made that kind of commitment. I guess it partly depends how long we have to wait, and obviously all of us have a job through all of the channels available to us to keep pushing that message. But I have a feeling in England, at least, to use that sort of horror film cliche, that sort of help isn't coming, that we can't just keep waiting. We've got to kind of do exactly what you've mentioned, Natasha, and I think Patricia's come in on, of kind of how can we find, whether it's local authority by local authority, regionally, by experimenting, by sharing learning across what we're doing in the 4 nations and other countries, of kind of what we can do within what's available to us, recognising that it's just simply not enough.
Thanks. Jonathan, did you want to comment on that?
Yeah, it's an interesting point just about how we as a society value social care and what role models we have around social care. I think there's work we could do around the widescreen, so the wider media approach to how you reposition some of those roles in terms of people's impression of what social care is about and the roles within social care, and see them as valuable. Brexit, the COVID response was mentioned earlier, and I think we kind of missed an opportunity there, didn't we, about how, I think you mentioned it at the outset, but how valued that response was during the COVID pandemic, and yet we've not capitalised on that sort of output from the population. So that, and really just think about the outcry there was, not away the political methodology here about raising NI contributions at one stage. Just see the public outcry to those sorts of matters. Really sums up where we are in terms of people's views about investment as a society in social care, because we have to invest in it one way or another as a recipient, or indeed in planning its future delivery. So I think there's somebody needs to grasp that in terms of a societal change issue.
Thanks, Jonathan. Caroline Abrahams.
Hi, thanks. Hi, I'm Caroline from AGK and also from the Care and Support Alliance. And I thought this was all going to be too consensual, so I thought I'd spice it up a bit and be a bit heretical. So I wanted to make 2 points. I hope people like my friend Donald McCaskill will still talk to me after I say this. But I wondered what would happen if we talk less about social care, which nobody knows what it is, and we're never going to persuade the public to really want to engage with, really, until it's a pressing need for them, and talk much more about people, and talked about disabled people and older people and what they need, or somebody with MND or MS, or you know, a 23-year-old who's learning disabled, got his whole life ahead of him, and hopefully a great rich life too. I just think we're sort of slightly flogging a dead horse, trying to advocate for a concept which, when people haven't got a good starting point for it. So that was my first point. And my second point was, I thought it was really interesting, the slide, I think it was Patrick showed, I think it was Patrick, it might have been Catherine, sorry if I got that wrong, of the two kind of different views of what the future of social care should be. The kind of more institutionalized, rigorous one on the one hand, and the more kind of flexible one on the other. And I think one of the problems we've got, associated problem, is they're both right, but they're right for different people. And this kind of drives me nuts a bit about the social care debate, because actually for older people who are nearing the end of their lives, who've got multiple long-term health conditions, for whom integration with the NHS is absolutely crucial. They don't care whether it's a social care person or a health person, they just need a whole bunch of stuff all wrapped around them in the way that works for them. They probably need that really quite rigorous stuff. But again, you know, my friend who's 23 and learning disabled, and his whole life ahead of him, that's no good for him at all. It wouldn't work for him, and it would be utterly patronising and awful. He needs something really different. And I think we just should be more open to that. It's almost as though if you argue for one or the other, you're wrong. And I just don't think you are. I just think social care does a fantastic job for loads of different people. So trying to say there's only one thing kind of defeats the purpose. Anyway, I hope that spices it up a little bit.
Thank you, Caroline, for that challenge. Yeah, so one size fits all approach. Is it all about the language and how we're using language? How can we get that diversity into the debate and that nuance? Patrick.
Yeah, just to respond on that. I mean, I think you're right, and I think that's part of what we kind of came to the conclusion in the book, is that there are these kind of seemingly kind of different sets of values, sets of approaches, which you kind of consistently hear from people from particular perspectives. So, you know, you might, and like you said, you know, people that come from organizations which might be advocating for younger learning disabled people might kind of prefer this more differentiated, personalized paradigm, and those advocating for, you know, perhaps frail older people who are kind of in and out of hospital, you know, needing that kind of much more structured, integrated response, would prefer this kind of much more you know, kind of standardized and more centralizing approach. But there are tensions between the two approaches. You know, I think in some ways, you know, there are trade-offs here, and I can't remember who said it, but it's not just about saying, well, there's not enough money, but it's about kind of having a process for kind of exploring some of the tensions there between these two approaches, and that's what we suggest. And I think, you know, it's as much, and Donald talked about kind of a reinvigoration in the chat, talked a bit about a reinvigoration of local government culture, and I think, you know, there's a huge role for local government perhaps in, you know, participating in a process to manage the tensions between these two approaches, because of course, you know, but we do need both of those things, but they don't always kind of mix in a very coherent way. So we need a process to negotiate between them.
Yeah, thanks for those reflections, Patrick. Yeah, I'm wondering if there is a world in which where we have some sort of framework to deliver consistency, married or balanced with a flexibility to allow for that diversity on the ground. And in a couple of the international examples we've looked at, Germany and Japan, they have, well, Japan in particular has managed to seemingly marry that framework at a national level. It offers consistency balanced with quite a lot of flexibility and diversity on the ground at a local level. Donald, do you want to come in here?
Thanks, Natasha. And I've long ago learned never to disagree with Caroline, so I completely agree with her. And in essence, when Scotland tried to develop self-directed support as a piece of legislation, it was based on what was happening in Queensland in Australia, and it was all about enabling anybody who needed support in order to achieve, not to meet their needs, but in order to achieve their outcomes, what they wanted from life. How did you enable that to happen? And that's why, you know, I agree with Patrick and others. We need to demystify what this is about. This is about enabling people to live their lives as full citizens in their community. I think it will need a much more radical, holistic reform of local governance, or of housing, of the interrelationship between acute primary community and social care in its traditional sense provision. But Caroline's absolutely right. We've got to start with the citizen. We've got to give them more control and autonomy, which they have in virtually every aspect of their life, apart from when they hit the world of social care, where we put so many barriers, so many obstacles in place, rather than giving them the autonomy of a budget, of finance to spend and do with as they want. And the reason SDS has failed in Scotland is because of all the gatekeeping, all the vetoing at local democratic level, and all the fear and risk management. But if we really want to have radically transformed social care system, it's about bestowing trust in the citizen and removing the barriers that we spend most of our time in the world of social care creating and redesigning and just renaming. Thanks.
Yeah, thank you for that, Donald. So I think there's possibly a tension here, or maybe a difference of opinion about how to go about reform, and whether it is what's needed is a radical, holistic and comprehensive reform, or if a more realistic way is step by step, small change. And I think we heard maybe a difference of opinion between our speakers. I don't know if some of you want to come in on that point.
I think I can, I guess, perhaps the difference isn't so massive in the sense of, I think there is a benefit in really, of course, in having a big proper narrative and vision around this, because without that you won't get the public support and you won't get the public investment. And the places that have done this, like Australia, for example, have really worked hard to do that. But perhaps it's about the implementation and sort of more staged approach to implementation, so that you're not trying to do everything at once. But it's also about recognizing, even if you have stage implementation, you need to think about, what the interdependencies, and not let, when something like self-directed support then gets kind of subsumed by other priorities, that those things get forgotten. So it's about making sure you've got that clear kind of future proofing of thinking, as I said, with the Affordable Care Act in America, they thought, who are the enemies of this going to be? Who are the people who are going to want to derail it? And what things can we put at this moment where we've got the political energy and the political consensus, this moment, what are the things we can put in the legislation and the implementation plan which will minimise the likelihood of it being derailed? So I think it's thinking a bit more of kind of having that kind of future proofing.
Mm-hmm. Yeah, thanks. Thank you, Catherine. I don't know if anyone else wants to come in on that point in particular. Patricia, you look poised.
I suppose, Natasha, I mean, I think in Northern Ireland, sometimes we can sit around and wait for the big thing to happen, where you have the sort of the agreement about how we're going to move forward. It doesn't really work that way. And I think we're in such a position in Northern Ireland at the minute that it is better to be doing something. I agree, we have to keep an eye on the interdependencies, and positioning this Social Care Collaborative Forum within a broader transformation agenda means that the department will need to do that in terms of interfaces with other things that are happening. But I don't think we can afford to sit around and wait. I think we have to start to do something, and there are things that are within our means, within the providers and the department's means, to be able to find solutions for and to make change that incrementally we can build from the ground. And I think that's what we're trying to do now with this new Social Care Collaborative Forum, because we have waited for a long time, but nothing has got better. And we need to start with where we feel the immediate pressures are as well. So I can see and feel the tension between the two, but I don't think we feel that we can sit around anymore. I think we feel we need to begin to work towards solutions.
Thanks, Patricia. Sue Evans, can I invite you to come in?
Thanks very much. I'm Sue Evans, Chief Exec of Social Care Wales. So we're the workforce regulator in Wales, but we also have responsibilities for improvement. So a big task ahead. I think one of the things I've reflected on, listened to the conversation, you know, great presentations and contributions from everyone, is a couple of things. In Wales, our legislation is the Social Services and Wellbeing Act, which is fantastic legislation. And we've just had some evidence about the implementation difficulties that, so the act is right, the legislation is right, but implementation has really been a challenge. And I think it focuses on this well-being context that a couple of us are talking about now, which is we've lost that focus on social care is about supporting the well-being of citizens. People are seeing it more as a, like you say, something to support the NHS. So that narrative piece for me is critical, and myself, Patricia, and other regulators across the UK are starting to think about what is the narrative? What is the narrative we need to help people, politicians, citizens, families, not just people who rely on care and support, but a general conversation and descriptor, which is much more meaningful. The other observation I'd make is if you look at Northern Ireland, in theory, having health and social care as integrated trusts should be a good thing, but I'm not seeing any evidence that social care benefits from being, you know, within the NHS. And there is that dilemma, isn't there? Top-down control and conformity, consistency, or enabling people, which means citizen-centered, people-focused, different. But I think, you know, we've just got to deal with that. We will have both. We will need to have both. And potentially, you know, most areas will have, Wales has got regional partnership boards. England has now got the ICS. So there is, I think, an opportunity for us to do that very local, the national in terms of standards, but maybe the regional is a place where we could collectively coordinate to find some of the benefits of the scale that is difficult to do at a local authority level. And maybe there's something about each of the nations, you know, learning from each other in that, you know, where is the regional space that could help us all get to a better improved system whilst we wait. And I agree with Patricia and others, we can't sit around and wait for politicians to decide and redesign. We do have to move, I think. Thank you.
Thanks.
Natasha, I'll
Yeah,
just come in on Sue's point because I stayed away from the integration piece today. And I mean, you know, integrated health and social care, you know, there should be benefits, but part of the problem, I suppose, within our system in Northern Ireland in relation to social care being part of the health and social care trusts, when it comes to decisions around budget, acute pulls on the budget all of the time, and that's what happens. So it's the decisions around budget where social care will fall foul within that integrated system, and that's one of the big issues for us, I think.
Mm-hmm. Thanks. Yeah, I think that point about that regional level is a really interesting one that's maybe been a bit underexplored. Stuart, you put your hand up at that moment. Do you want to come in on that point?
You know, I was just really interested by Sue's point about learning between different devolved nations. I think my colleagues here at the IFG would argue that one of the benefits of devolution is that it's an opportunity to run basically policy laboratories, they would call it, across each of the devolved nations to try something in one nation and learn, see how that goes and learn from their experience and maybe implement it in another devolved nation. I think another problem, though, that we've found in our work when we compared the performance of different public services across the devolved nations, and I'm sure Camille and Emma found this when they were doing their work on devolved social care, is the difficulty of actually making those comparisons and the lack of good data that is really comparable across the devolved nations and England as well. And I think that makes it nice in theory to think that we can look at how integration has gone in Northern Ireland or how free personal care runs in Scotland, but it makes it difficult to learn the lessons and to try and draw out conclusions of what the impact would be for other nations. So yeah, interested to hear if anyone's has got any thoughts on that.
Camille, do you want to comment on that?
Yeah, I was looking to raise my hand, but I was being too civilized. Yeah, I completely agree with that, Stuart. And I've just popped in the chat a piece of work that we did a couple of years ago, which looked at well, we try to look at the impact of integration across the 4 UK countries, and it was a real challenge, you know, to be able to, you know, when things are recorded differently, different definitions are used for the same thing, different ways of collecting data over different time periods, makes it really difficult to kind of draw those conclusions. And I've been really fortunate in the social care work that we've done across the UK to be able to talk to people, many of which are on this call, to help us kind of get that understanding. But I think it would be really interesting to kind of throw that back to the panel and to the people who are here to kind of ask, well, are there ways in which we should be learning more from each other across the UK, and are there things that we should also be doing together? I think, you know, we've talked about the potential benefits of doing things at a regional level and pooling some of that, you know, so we're avoiding potentially some of the challenges of working in sort of very granular levels. But are there also things that we need to be doing across UK? Is that, you know, setting the vision, is that something that we need to be doing across UK, or other things? I don't know, really just interested in people's thoughts.
Thanks, Camille. That's a really good question. I don't know if anybody has any immediate thoughts on that. Patty? You're on mute.
Yes, sorry. I was just trying to come off mute. I have a bit of a cough, so I'm sorry if my voice sounds a bit weird. But at Engage Britain, we did a piece of work to bring people together that work in social care, that use social care services, that run social care services, that design social care services, and that work in like the policy around social care services. So I think I truly believe, and I'm a strong believer, that the best way to create like the vision and the solutions moving forward are to include the people that would be most affected by those changes in every single step of the process. It's the only way to make a sustainable change that could actually work and be supported by the people that would need, that would, you know, be ruled upon, if that makes sense. So yeah, I shared some of the work that we did earlier in the chat. I'll reshare it, but it'd be great to hear more from everyone in this room as we continue to kind of push for this at Engage Britain.
Thanks, Patty. We are fast running out of time, which is a shame because I think there's so much more to unpick. But in our last 4 minutes, can I come back to our panel of respondents just to maybe reflect, give us one final reflection from the conversation, or maybe to pick up Camille's question about, is there something that we can do together, or are there better ways to learn from each other across the 4 nations? Donald, can I come to you first?
Oh, I hope you weren't going to do that.
Sorry.
I think there's 2 things. One is that if we don't know where we're going, we're always going to start in the wrong place. So I think that idea of being very clear about what it is we're wanting to achieve is going to be very important. And increasingly, you know, somebody who's involved internationally, I think most of the really creative insights of a lot of what we're hearing about today are out with these shows. And whilst it's always attractive to hear the language of a distant place, it's also quite insightful to hear how other peoples are struggling with the same issues that we're currently facing in the UK.
Yeah, thank you, Donald. Jonathan?
Thank you. Well, interestingly enough, in my role, I'm trying to bring together 22 local authorities to work together consistently across Wales, and that has its challenges in its own right. However, that doesn't mean we stop doing it, does it? I'd be very interested in terms of taking forward the UK perspective. Sue's already referenced, isn't she, from Social Care Wales, her links across the nations with her colleagues. So we just need to make sure we get those discussions in the right areas with the right people, and ensure that we get the right citizen voice into that discussion, and not, as somebody said in the chat bar, a tick box exercise. I take Patty's point in terms of engagement with the voices of care experienced people who should absolutely drive the future of social care in the UK.
Thank you very much, Jonathan. Patricia? Is Patricia still on the call?
Sorry, couldn't get my unmute
Sorry,
button.
disappeared off my screen.
Sorry, I was just making a number of points there in terms of sort of reflections back, and Sue has mentioned that as part of our Skills for Care and Development Alliance across the UK, and indeed that group includes Ireland as well, so it's not just a UK group. We are beginning to look, because they equally are regulating social care. We are beginning to start to look at how we develop a common narrative, for want of a better word, and that bit, Donald, I suppose, about, you know, what is the roadmap and what is the vision and where are we going? So what is that common narrative around social care? And that's we're at the starting point of that, but I think that has real potential. I think Patty's point about engagement is absolutely crucial, and certainly in terms of the collaborative forum that we've developed, we're aiming to do that. But we have done an awful lot of work taking the voice of not just service users and carers, but the voice of the workforce. Because those who are delivering social care, more often than not, people who are delivering it will know what would be better. So we've been doing a lot of work around engaging with our frontline staff about their experiences in delivery of social care, and obviously as we're beginning to develop career pathways. So engagement, I absolutely agree. And within our the terms of reference for this forum, citizen is right at the heart of it. And I think that somebody talked about, let's change the rhetoric to people. I totally agree. I think that's exactly what we should be doing. And that's a big, important takeaway from this for me today.
Thanks, Patricia. And finally, Stuart, in the last few seconds.
Thanks very much. Yeah, I'll be quick. I feel like I've been reasonably negative today, so I'll try and end on a positive note. I think actually, despite the difficulties at national level of implementing reform, you know, talking to local authorities, talking to providers, there are often very good examples of innovation, of getting things done in the face of a lack of resources that is quite inspiring. I think it's about trying to find ways of sharing those learnings at a sort of at a larger scale that would, and also across the developed nations, that I think would offers a lot of opportunity without the support from national government.
Yeah. Thank you. That's a really good point. We are out of time, so just leaves me to say thank you to our speakers, our panelists, especially our panelists being so disciplined on time, and thank you to all of you for coming and for sharing your thoughts. It's been a really interesting conversation, and I think just one that's starting, and we're very keen to continue this debate and conversation in the future. So thank you very much for coming, and we'll hopefully keep in touch.